Hello and welcome to another episode of Younger by the Minute. I am your host, Jamie Spicer, and I am with my lovely co-host,
Jennifer Spicer.
And today is going to be one of your favorite talking points is going to be fall skincare.
Yeah, so I really wanted to jump on and just do a quick podcast about what you should be thinking about when you're prepping your skin for fall and what that all entails. Because as we come out of the summer months, you have sun exposure. The skin can be dehydrated, which causes excess oil production to help compensate for the dehydrated or just compromised barrier. And that can really just change the texture of the skin. It can lead to more congestion, which can lead to acne. It can also lead to sun damage. So it's really important to think about what you're doing as the seasons change and also how to undo what you've done over the summer.
And I think we've covered this before, and I know I've heard you talk about it. Sometimes people are using too much product and drying their skin out. And then I think with the exposure to the sun and everything, they're probably trying to do too many things, which is also causing a problem.
Yeah, and I've been guilty of that too because I have acneic skin and you sometimes think that more is better, and that's not always the case. You really want to make sure that you have a healthy balance between things that are going to stimulate regeneration. So those are things that are going to help with cellular turnover. Those are your alpha hydroxy acids, things that exfoliate like scrubs. And if you overdo it and you cause an over sloughing and an overproduction of the oil, you're actually just going to chase your tail. You can also sensitize the skin, which is going to really expose the barrier to have more sensitivity. So you can have redness and you can create more of an issue. So it's a healthy medium between using actives, which are, like I said, are your alpha hydroxys, right, your enzymes, and then also using things like antioxidants and really good moisturizing agents like ceramides and things that are most like our own oil or sebum, because the more that it's most like ours, the more that the skin is going to really recognize that and soak it in.
So what would you recommend as far as your favorite top 2 or top 3 things to do after the summer to really repair and rejuvenate your skin?
Hopefully you've been really watching actives over the summer because they make you more sensitive to light, which can further damage the skin. So what I really like to do is a combination of a retinol or even a TCA. And when you're looking at the molecular structure of acids, they have the smallest molecular size. So they go deeper into the skin. They're really going to help to slough the inside of the pore because that's lined with skin cells. And they're going to go into the dermis, which is where collagen and elastin and the living layer of skin resides. And so the smaller the molecule, the deeper it's going to go. And if you use retinol and TCA, that's going to help with refining and it's going to help with texture. But when you use it with a pigment corrector, kojic acid or arbutin, we're getting away from the HQ or the hydroquinone because those can be toxic. But when you use them together, they work better together. They are more synergistic and they're going to yield a better result. Really combining those two actives can really yield a best result when you're doing at-home skincare. I also really recommend that people bump up the moisture because now the weather is changing. Everything's changing from the physiology of the body. And you really want to make sure that you're using something like a hyaluronic acid, a ceramide, something that the skin recognizes and that's really going to cross that barrier and help. Because a lot of times we think that, the thicker the moisturizer, the more hydrating it's going to be. And in some cases, that is the case. If a woman is postmenopausal and she's lacking estrogen, she's definitely going to need a thicker, buttery moisturizer. But you don't always need too much. And there's always a technique called sandwiching. So retinols and actives can be very sensitizing like we discussed. So you can do a light layer of moisturizer, then a light layer of your active, and then another light layer of your moisturizer. And that can really help. And to your point earlier of overdoing it, when you start to include actives again into your regimen, you don't want to do them every single day. You want to rotate them. You want to do them like 3 times a week and slowly build that up because you will cause your skin to become very sensitized.
And I find that interesting that you said rotate them in because just like with food, we want to rotate food because your body can become resilient to it. I also find it interesting, just like with certain seasonal foods, we want to rotate that in. So what do you recommend as far as skincare when you're getting ready to change season? Like now we're getting ready to go into fall. So I talked about coming out of summer. What do we think is like people need to start thinking about going into the winter months, going into the holiday seasons, like treatments they should think about doing before they get into their holiday grind and parties?
Yeah. So I It never fails. And I know the days get away from us all. We have that event coming up and we're like, oh, we're going to call and we're going to make that appointment. And then it's the week of or 2 weeks before and we're not there and we haven't booked our in-office treatment. So it's really important to create a comprehensive plan that's going to include things that if you have pigment, it's going to have light-based therapy to break apart that pigment. It's going to have deeper treatments of those alpha hydroxy acids, like a TCA peel, like we love the PRX peel, or even how you stack them. You can stack treatments to yield better results. One thing I learned early on as an esthetician is that instead of doing a series of 6 IPLs or 6 VI peels or whatever, you actually yield a better result and hit more of the skin conditions if you do 3 and 3 and you just alternate that way. So that really helps. But you really want to make sure that if you're planning for an event and you need to do some really aggressive treatments, that you give yourself a couple months for the skin to really go through that healing process.
Right.
And then if you're doing injectables, depending on the injectable, you want to give yourself at least 8 weeks, if not 12 weeks. So now is the time. September is the time you really want to sit down with your provider and make a plan. And it should be all encompassing. It should include retail that you do at home. I tell people all the time, like, it's like going to the dentist without brushing your teeth if you're not using the right skincare at home.
Right.
You have to do at-home skincare to really augment the best results. And it's an extension of the treatment. And then you're going to really want to do your energy-based devices, your peels, your facials, and then your injectables. And that all needs to be spaced out and done in an appropriate way because things get layered and you have to be careful with how you do it.
Right. And very interesting points on that. You brought up bundling and stacking treatments for in-office and at home. Is there like a certain skincare regimen? I know we're getting ready to transition, but thinking forward as we get colder, is there certain like at-home skincare treatments you like to send clients home with because it's winter months and the air is going to be a little bit drier?
Yeah, like I love sheet masks we have an LED mask that we made for precision. I think those are great tools to really help do like at-home facials and really help restore the barrier because a lot of this stuff is stripping. And so getting that, it's also really nice if you have an event to use a sheet mask and the red light mask before the event to really help with penetration. Unfortunately, the skin gets beat up from the inside and the outside. I shouldn't say from the inside, it just doesn't get the nutrients it needs. When you drink, if you're underhydrated, your skin's going to be the first to show it, especially the eye and the lip area, because that's the thinnest skin. But also you got to think about the environment. Depending on what your HVAC system is like or where you live, you have to realize that the environment is going to cause evaporation from the skin. So you really want to use things that are going to help lock in that moisture because you have to deal with it from both external and internal factors.
Gotcha. And what about any like supplements? Like I know we carry some things and I've heard you recommend some things. What are like some supplements that would help augment the skincare, lasers, fillers, tox?
I think making sure, depending on age, that you're taking hormones if it's safe to do and your physiology and provider feel like it's safe to do. Once estrogen is gone, moisture is gone, collagen starts to deteriorate even faster. But things that are going to help outside of that are going to be like hyaluronic acid. You can take oral hyaluronic acid, and that's what a lot of fillers are made out of. It's also what lubricates your joints in your skin. So taking that orally helps when you have it depleting. Not all glutathione is the same. It usually is best liposomal if you're going to take it orally, but it's really best via IV or intravenously. And it's the mother of all antioxidants. So that's going to help decrease inflammation, which causes aging, but it's also going to be a natural skin brightener. Obviously, vitamin C. Vitamin A is really important for cellular turnover from the inside. If you think about it, Accutane is high doses of vitamin A.
Right.
So vitamin A is really, really good for sloughing of the skin and helping with refinement and collagen stimulation. It's really important to have adequate amounts of K2 because K2 works on a structural level for collagen, but also K2 is really important for the conversion of vitamin D. So it's really important to make sure that you're not micronutrient deficient because that's how the skin cells work. So rule of thumb is vitamin C is really good for inside the cell and vitamin E is really important for the cell wall. Oh. So you really want to make sure that you're going from a cellular level and building the skin from that.
Right. And I've heard you talk about multiple times about how zinc will actually help support and lengthen your longevity of your tox.
Oh yeah, thank you for that. Zinc deficiency will cause neurotoxin to deteriorate faster, to decline. And like if you get sick, that will make it go away faster. Also, though, zinc deficiency is one of the things that can cause acne. So making sure that you are not zinc deficient. And even I do think that collagen helps, whether it's placebo effect or not. And I know there's a lot of mixed studies out there, but I can tell you that when I take our collagen, especially the marine collagen, I find that I notice a difference in my hair, skin, and nails. When I take powdered bovine collagen, I notice a difference in my gut health. And so I don't know if that's just me, but that's what I've noticed.
Right. And then I'll throw on there from my standpoint with the nutrition, ensuring that you are supporting gut health with prebiotics, probiotics, hydrochloric acid if needed, because you're having acid reflux, GERD, IBS type symptoms. That's going to be vital to ensuring that you're having good gut health so you're not having breakouts because of it.
Yeah, a lot of people don't realize your skin has a microbiome too, and making sure the internal microbiome is right. If gut health is off, a lot's going to be off. If you're not eliminating properly every day, you increase your risk of melasma because it doesn't allow your body to rid itself of the estrogens that can cause inflammation and stuff like that. The other thing is making sure that you're eating adequate protein. And this will segue into one of the next topics that we're going to talk about. But your skin and your hair and everything are made of protein. They're made of amino acids. And so many people are so catabolic right now because they're trying to lose weight, or they just don't get the amount of protein that they need. And I think that's a common misconception. You talk about it all the time, that people are under eating.
95% of the people that I have worked with over the last 20 years, when we started with them, were significantly under eating.
Yeah, I was under eating.
Yeah.
And the other thing that I think that people don't realize is when you don't eat protein, when you eat a carbohydrate, more specifically a simple carb like fruit, I'm going to grab a banana, I'm going to eat an apple. Your body can only utilize so many grams of sugar at one time. That excess sugar actually binds to collagen fibers and it makes them brittle like a old dried out rubber band. It will just snap.
Laffy Taffy.
Yeah, so you want more Laffy Taffy though. You want that stretchable.
You want warm Laffy Taffy.
You don't want cold.
Right. Which is like what we talk about in like stretching the muscle, right?
Yeah.
You don't want to just go warmer stretching muscles when they're cold, because it's like trying to stretch cold Laffy Taffy.
And I will say that there are a few things. I had a great meeting with a friend that's an esthetician that I've known forever since I moved to St. Louis. And we were talking about skincare. We were having a meeting about skincare. And you can use all the lotions, potions, and things that you want, but it has to go beyond that. And it's about lifestyle. It's about what you choose to consume in your body as far as foods, but what you watch, the stress level that you have,
the inflammation you're causing.
Right. And then your lack of sleep or hydration. Those are really big things that you have control over. Genetics are one thing, but we can change them. And just making sure that you think about it from every angle, that's going to yield the best result overall. And another thing that I really want to make sure people understand is you actually have damage from overhead lights and UV radiation. UVA rays are out anytime the sun is out, like period. And so you want to be making sure that you wear skin protection, sunscreen every single day, no matter if it's winter or not. You have to be wearing protected skin. A golden standard rule is if you could only buy 3 things, it would be obviously a pH balanced cleanser, but that can be whatever. But if you're going to buy 3 really gold standard things, it's going to be a good sunscreen, a good vitamin C that actually works, that has the right molecular structure to work, and then a retinol. Those are tried and true things that can actually really provoke change. And then you can go beyond that. Yeah,
I would almost say that daily sunscreen that you always have me wearing, I always look at it as like that's my daily putting on my armor for the day to protect my skin from light.
I like that.
Yeah. And we talked about inflammation too, and you brought up red light mask. And I know you really like to ensure that red light mask is being used after certain treatments because it will calm down inflammation and that.
Yeah, that's the thing. Like it's like working out. You actually, for the skin to change, you actually have to create an injury response. And as we've evolved in aesthetic medicine, we realize that we don't have to create as drastic of an inflammatory response as we once thought. And actually it can cause more harm than good if it's pushed over the threshold. Add COVID to that and other things that are happening because we're exposed to so many things that the body can't deal with. So the rate of healing is slower and the inflammatory response is higher. A lot of people have crazy mast cell activation syndromes and they don't know it, which makes histamine and inflammation, which is good. But it's like, what's the threshold? What's the threshold for that person? You really want to make sure that you're not going beyond that. And then as soon as you hit it, you need to come back and heal. you have to make sure that your body's able to heal. And that's
Right.
where nutrition and being healthy and making sure you're sleeping is important.
I can speak firsthand. For almost 2 months, I was dealing with a retention cyst in my maxillary of my left side, and wearing the red light mask at night, as soon as I took it off, the inflammation around my eye and everything was noticeably down. Of course, the next day it would build back up, but using the mask on a daily basis, I would contribute to the fact of, one, it reduced the inflammation down and immediately right then and there as I went to bed. But also I would have to contribute as help with my healing process, especially even post-surgery.
I think it absolutely did help. And that's the thing, like, you have a higher inflammatory response genetically.
Yep, and histamine.
Yeah. And so I think it's just really important. So do I. And it's just, when you pay attention to what your body's telling you, that's a really big thing, because your body will tell you. And we are really careful at the spa to make sure that we're constantly asking people if they're not feeling good. Like, some people want to come in. I've even made that mistake of getting a massage when I wasn't feeling good. Your body needs to have its immune system in check for it to really go through and yield the best results when you're looking at it.
And if for anybody wanting to know, like, how did I know? Like, it was beyond visual. Going into the night, my face was swollen. It was putting a bunch of pressure behind my left eye to the point where I couldn't even wear my hard contact lens for well over a month. But by wearing the mask, and I was having a lot of light sensitivity. I was having to wear biohacking glasses no matter what light I was in. I could not be outdoors without sunglasses on. So after taking the red light mask on, my light sensitivity was down to where, being indoors, I would not have to have biohacking glasses on. My eyes were not watering as bad, and I could legitimately feel the pressure down around my eye and behind my eye. It wasn't just a visual. I could physically feel it, and again, with the light sensitivity. So those were the immediate symptoms I felt being relieved, beyond just seeing the swelling going down.
Yeah, I absolutely, like, when you were really good about it, it really helped you heal.
Well, that was the other part too. The more consistent I was with it, the better I felt. But
and I've had people, because we have the face and then we have the neck and chest, and I had someone tell me that, like, when their child has some abdominal pain, they'll put the neck and chest on the abdomen and they say it helps. And a little fun fact about medicine, there is something to placebo effect. And I'm not saying that, like, things aren't efficacious, because they are. But it's also the intent that you put behind it. If your body, whatever you think is actually truly what you become.
Right.
And so I also tell patients, in order for you to really yield the best aesthetic result, you, one, have to believe that you're beautiful, and you are, and you deserve these treatments. If you have this issue with body dysmorphia, which I can speak from because I have the same issue, it does make a big difference of what you think about yourself.
Absolutely. All right. Anything else you want to throw? So some tips and tricks, or we get everything covered?
I would say make sure, like, if anybody has any questions, I'd be happy to do, like, a skincare consult over email. You can send me pictures of your skin and I can guide you. Our team can guide you. Just make sure there are ways to make it budget friendly and to really sit down and plan exactly what you need. But you really want to be intentional when you're making your plans for the fall and winter.
Do we still have that woods lamp?
Yeah.
Yeah. You want to find something interesting about your skin, book an appointment, come in and put your face underneath that. And we can definitely, I shouldn't say we, because I have no part of this, but the spa team can definitely put together a treatment protocol to help fix whatever underneath that thing.
And the other scary thing that we can do now is assess your skin for true collagen. Like, with the alt therapy, we can scan and actually see how much collagen you really have or don't have. And oh man, I don't know if that was a good idea for me, but I am saying I already have my alt therapy treatment, and we'll just see how well it works.
And I know that you've measured some people and you're like, Jesus, their skin is XYZ thick. You're like, what the hell?
Yeah. Like, thank you for listening. And if you have any questions, please let us know.
We're always happy to have you guys tune in. We always hope that you guys walk away with a little bit of information that you didn't have prior to listening, and you know how to get a hold of it. So I'm tapping out,
but I am going to leave one last thing. Make sure that you really do research on the ingredients that are in your product list, because if you're not using a reputable brand, a lot of things can have stuff that's actually toxic that's going to actually accelerate some of the damage. Skincare can be very confusing, and that's why having a professional in your corner is the best way to go.
Great advice.
Tapping out.
Tapping out.
Audio Jungle.